Please adjust your sound to the level of this voice. It will match the sound of the narrator in the film you're about to see.
I'm going to tell a story of an experience I had as a nursing supervisor, one that taught all of us on this ward a great deal about what nursing is and what it can be. It begins one sunny day at 7 a.m., time for morning report.
Well, good morning. Good morning, everybody. What a lively-looking group.
Oh, yeah.
You better get into morning report. I have to go to another ward. It looks like it's going to be someday.
The head nurse is a recognized authority on ward management in this 400-bed, tax-supported general hospital. Her relations with staff are excellent. This ward has the lowest staff turnover in the hospital. The doctors say she knows as much as anybody can about observing and assessing neurological symptoms. She keeps the complicated equipment running like tops. She's the model head nurse, graduate of an accredited diploma school of nursing. She plays a key role in this story. This is the night nurse.
Good morning.
Good morning. Good morning.
You all look nice and rested. I've never had such a night. Every bed is full, and you're short of practical today. Let me tell you just a little bit about what happened last night, and then I'll give you the details about the cases. First, there was 3 admissions, a head injury, auto crash at 12:30. At 1:10, one of the characters from Skid Row found on the street convulsing. He's in sleeping it off. A stat admission at 2:30, girl, she's 19, barbiturate overdose, fight with her boyfriend. Well, that's all 30 of them. You know, it really bugs me when I'm so busy I can't give these patients the care they really need. I haven't even finished my charting yet.
Well, why don't you finish it up and go get some sleep? Don't worry. We'll pick up the pieces. It'll be better tonight.
It had been a hard night, all right, but nothing to the 8 months trial we were all about to enter.
This is going to be a very busy day. Flo and Jerry, remember we have 6 patients going down for x-ray this morning. Flo, since Mrs. Murphy isn't here, I'll have to get help from the supervisor for you. And Jerry, remember the doctors are making rounds on your side at 10. Please have your sickest patients done first. Bernie, you'll have to help on both sides today.
I'm going down and see the girl on the artificial kidney. After 7 years as supervisor here, I'm just back with a new master's degree. It's good to be in the wards again. Pretty little thing, isn't she? You've had quite a night.
Yeah, I'm beat.
Well, good morning.
How was your weekend? Sure, I'm glad you're back. I don't know why it is, but things seem to get in a mess around here when you're off.
We are quite short today. We could use some help.
I've already been working on it. They're mighty short-staffed all over the house.
Say, when are we going to get some more of those pretty student nurses around here to liven things up a little?
Is that all you can think of with all this going on?
Well, it just so happens you're going to have some coming Monday, and I want them treated gently. After all, they have other things to learn besides the doctor-nurse relationship.
Well, that's a typical old maid's remark.
I was wondering if you could discharge Mr. Peters. We have no beds. And if we would get a new admission, I don't know what we'd do.
7 South, Mrs. Bryant, ward clerk. Thank you. A new admission's on the way up. I'd better tell Mrs. Jenkins. Mrs. Jenkins?
Well, that's all we need.
And here the story really begins. Emma Reynolds, partially paralyzed, difficulty in breathing, coming with her husband, and what must be everything she owns onto a ward that already is straining at the seams.
Look at all that stuff. I'll call a storeroom and get a bed, but we're going to have to put her in the hall. I hope we can make her comfortable. She's going to have to get rid of some of that junk.
From such stuff, this story is made. It is 2 busy hours later.
Send up that support. Flo, Dr. James wants to do a spinal tap on Mr. Kelly. He'll be here in 15 minutes. Would you please call Dr. Matthews? Mrs. Wilson's blood pressure has dropped. Jerry, they're sending out the Foster frame for Mr. Taylor very soon.
Would you complete the draw sheets?
I'll order some. Thanks for telling me.
Maxine, I've tried to beg, borrow, and steal some help, and there just isn't any today. How's that new patient making out?
She's had the whole staff jumping. They're just about ready to crawl the walls. I know it's not very pleasant to be out there in the hall and not have a room, but we have a lot sicker patients, and they're not complaining. We'll try and move her into the ward this afternoon.
I'll tell her. Mr. and Mrs. Reynolds, I'm Miss Little, the nursing supervisor, and I'm real glad to know both of you. I'm sure you're not too comfortable out here in the hall, but we'll have you in one of the wards real soon.
A ward? She needs a private room. She's been sick for 9 months.
You make them find me a room, John.
Well, we just don't have a private room available. We'll look after her. Don't you worry. Where are you folks from?
We're from West River. She was in the hospital there.
Nurse, can you rub my arm?
I thought at first it was the flu. The doctors did.
My neck, too, and that pillow's bumpy.
Then she couldn't move her arms or legs very good, and they thought it was polio. We had her home for 4 months, and we had a nurse that really knew how to take care of her. We took her to a rehabilitation center at Dawson River, and the doctor said that she wasn't getting any better, so that we'd have to have her hospitalized to find out what was wrong with her.
John, take the covers off of my toes. Can't somebody get me a fresh drink of water? I'd just like somebody to pay a little attention.
I hope they can do something here.
Mr. Reynolds, we have the best specialist. Don't you worry.
I asked them to bring her some fresh water, and they wouldn't do it. They just said to get her things out of the hospital.
Mr. Reynolds, we have no place for all these things in the room.
But they're my things. I need them.
I'll bring you some fresh water and be right back.
I'm going to leave you now to get a hotel room before it gets dark. Don't you worry. They said everything's going to be all right.
Mr. Reynolds, the hospital's been trying to get you. They say it's urgent.
Hey, you forgot your parcels.
She couldn't get her breath all of a sudden.
Mr. Reynolds, we had to give your wife a tracheotomy, an opening into her windpipe there so she could breathe. But she's doing very well.
Why? I've only been gone a little while. I'll take care of you, Emma. I'll see you're all right.
It is 2 months later.
Hi, where's Bernie?
Oh, she won't be able to get here. She's still with that Mrs. Reynolds, and she hasn't had coffee for 2 days.
I don't understand how anyone can be getting so much better and act so much worse.
Well, how do you like the way she clicks her teeth at you?
I never said this before, and I know she's a very sick woman,
But I don't like caring for her. Makes no difference what one does for her. It's never right.
Well, I've tried for the last 6 weeks, and I still can't like that woman.
Okay, we're going to roll you over now.
After 2 months in the tank respirator, Mrs. Reynolds has now been introduced to the use of the shell respirator and the rocking bed. Her tracheotomy is plugged at intervals so she can speak. But the degree of real communication between her and the staff is very slight. She's a demanding patient, and one they never seem to satisfy. When her tracheotomy is unplugged and she's unable to speak, she has developed the annoying habit of summoning staff by clicking her teeth at them.
I think I better unplug you now, dear. Well, I finally got time to take care of you. Let me fix your pillows.
Couldn't you get a hold of those teeth and throw them out the window?
What is it now, Mrs. Reynolds?
Oh, honey, please give me a drink of water. I get so dry. You're always so good to me, and those other nurses are so impossible.
I sometimes have to look after the other patients, too, you know.
I have to be suctioned, too, dearie.
No matter how hard we try, we just can't please her. She's a spoiled woman, pampered by that old man. And he's under feet all day, always complaining, and so is she. My staff don't like to take care of her. I have to rotate them with her.
Now, what do you know? She wants a shampoo before her husband comes. What does she think this is, a hotel?
There she goes with those teeth again. Yesterday, we ignored her and found her cyanotic and almost unconscious. If we suctioned her every time she wanted, that's all we do, but we're afraid to ignore her. When we got in there yesterday, she was blue. It was almost as if she'd done it on purpose. I wished we'd transfer her or get some more help. Here he comes. More trouble. You take care of his complaints today.
She doesn't seem to be getting any better. They don't take care of her now. I keep telling them, but they don't pay me no mind.
Well, there's no need to go in this room. This patient in the first bed around the corner is Mrs. Reynolds. She's been here 4 months and has got Guillain-Barré syndrome. Medically, our most serious problem is the increasing paralysis of her extremities and her diaphragm. And these have created some pretty tremendous nursing problems, such as keeping her airway clear, maintaining good skin care, preventing contractures, keeping her bowels and bladder functioning normally. This is taking a lot of work, and the gals have done a fine job, but she and her husband don't appreciate it at all. They've been at the staff ever since they got here. Well, let's see the next patient.
She complained about Marilyn again. She talks about all of us.
I know. You go do your other patients. I'll go see what I can do.
Hey, who does that remind you of?
She said you left on a bedpan yesterday and forgot her.
Oh, we put her on that pan 6 times, and she still didn't put out.
Mr. Reynolds, don't you know she's on a 1,000-calorie diet? If she ate that, she'd have all the calories she can have for the rest of the day.
When she didn't get enough breakfast, they feed her too fast.
Yesterday, you brought her a hamburger and a milkshake. You know she's on a diet and she has to lose weight so she can breathe better. You also are well aware of the hospital rules that no patients are to be bought food or drink.
Yesterday, they wouldn't give me the bedpan. I couldn't wait. I went to bed. John, I felt awful. They just don't seem to like me here. I like them, but they don't like me.
It seemed to me like every second day I was called on the carpet over the Reynolds case. Things were getting worse month by month, even though we were doing everything we knew how to do for her, or so we honestly believed at the time. Well, our dear Mr. Reynolds has now not only gone to the medical director and the hospital administrator, but he's even written the state legislature. The director of nursing service knows perfectly well what you're going through, but she can't give you any more help. We'll have to do the best we can.
I've been in nursing 10 years, and I've never had a patient as bad as Mrs. Reynolds.
Well, thank goodness we have that new student coming Monday. And she's here to learn about complex patients, and she has more time. That should give you a breather.
Why did I ever go into nursing?
Why do we go into nursing? What meanings does it hold for us?
At the beginning of this term, you all summarized what nursing meant to you. I wonder if you could tell me what nursing means to you now that your psychiatric experience is almost over.
Well, it seems that in psych, we've learned more about people. Nursing the mentally ill isn't really so different from nursing people in a general hospital. They get depressed too and don't eat.
I think the way a patient acts will mean more to me now. I got so busy that I don't think I ever really listened to what the patients were trying to say to me before.
Sometimes the physical treatments you give a patient are most important for his recovery. But at other times, it's the way you make him feel that seems to help.
The most important thing to me is that I'm beginning to see myself as a person, the way I affect the patient and other people as well, like the staff. Of course, it's not something that you pick up in just a minute, but I really feel like I have a beginning. And I think maybe because of it, I'll be a better person and a better nurse. I just know we'll be able to do a better job now with general hospital patients. I'm really excited about going to Mrs. Jenkins' ward. She's the best head nurse I've ever seen.
Not one of us could foretell the events which were to happen now. How this stronghold was to be breached by a mild-mannered student with their own convictions about the meanings of nursing.
Well, I know Wilson and Jones again. How about you?
Duffy, Fraser, Cook, and Woodbury.
Brother, I think you're going to have a bigger job than I have today. Well, boy, have you got a little on your hands with Reynolds.
Good luck. You'll need it.
Hey, there's a real cute resident who'll be glad to hold your hand if you get in trouble.
Don't call us, we'll call you.
Well, let's see what she can do with those psychiatric, tender, loving care principles.
Well, hello.
Good morning, Mrs. Reynolds. I'm Stephanie Andrews, student nurse, and I'm going to be taking care of you for a while.
Oh, dearie, I'm sure glad to have you. They'll love and comb my hair before hubby gets here, won't you? Oh, here he is now. John, this is my new nurse.
Have you ever looked after a case like hers before?
Dearie, get me a drink of water.
Perhaps she doesn't need our sympathy. These next few weeks will tell.
Hi. How's it going after 2 weeks?
Just fine. I really like her, and I can't figure out why the rest of you don't.
Hey, Doctor, I'd like to speak to you about my wife.
Mr. Reynolds, what would you like to know?
I'm very concerned about the attention she's getting here.
I just don't think that the staff pays enough attention to her. I don't think she's too demanding or complaining. I let Mr. Reynolds feed her today, and they both really liked it.
Do you think it's wise on your part to make this kind of decision? What if she would choke? How would he handle it? I know you're here to learn, and I know you like to try different things. But just because you have time, remember that we don't. Please don't spoil her for us.
2 months till I graduate, and now I find that all this stuff about personalized nursing care for the individual patients is for the birds. You give them their baths, you do their treatments, and you change their beds. That's what nursing is. And Mrs. Reynolds, she isn't a person. She's just bed 1, room 14, and an order sheet. And that poor old man who hasn't got anyone else in the world except his wife, and who wants to help, and who hasn't got anywhere else to go. He's just a thing that gets in our way. Banish him. Get him out of our hair. I will be a good girl and get a nice, shiny degree. I will be the doctor's soft, feminine, and efficient handmaiden. And perhaps in a couple of years, I'll be a wonderful head nurse like Mrs. Jenkins, admired and respected by all, who doesn't care in the least that Mrs. Reynolds is a poor, frightened woman who's afraid she's going to die.
I ran into the problem quite by chance.
Well, hi, Stephanie. How are things going? Well, if you really want to know, Miss Little, if I don't talk to someone, I'm going to blow my top.
Well, do you have a minute? Why don't you come into my office? Okay. Come on in, Stephanie. Sit down.
Thank you.
Well, what's the problem?
I guess it's Mrs. Reynolds. I think that I know how to take care of her, and yet I'm really wondering if the staff here does.
It seems to me, Stephanie, that the staff spend more time with her than any other patient on the ward. I think they're doing a good job against big odds. Look at her skin. It's perfect. She doesn't have any contractures or foot drop, and we haven't had any lung complications with her tracheotomy.
Well, I know, but that's what you do for any patient. And Mrs. Reynolds isn't just any patient. She's a person.
She's an impossible person to satisfy.
But no one tries to. They avoid her. All these requests for a drink of water and suction my tracheotomy and bring me the bedpan, they're just ways of getting attention. She's afraid. I think she's afraid of dying. And her husband, he's afraid too. He wants to spend every minute that he can with her. She's everything he's got. Look, I've had this in theory until it's running out of my ears. You plan personalized patient care around the needs of the individual. The physical needs, the emotional needs, the environmental needs, the socioeconomic level, the rehabilitation needs. They're not doing that here. Sure, this is a great ward for physical care, and Mrs. Jenkins is just tops. Well, if I ever had a head injury, this would be where I'd want to come. But that's only half the problem.
In this mirror, I see myself, and I don't like what I see. Most of what she said is all too true. I know all these things myself. How could I have lost sight of them?
Why doesn't anyone pay any attention to me?
To me, she's just been a difficult patient. Why couldn't I see her? I've been concentrating on the same old things. Staffing the wards, hospital policies, routines, doctors' problems. I've been blind to this patient's problems and to the real needs of the staff. What am I going to do now? Some people you can talk to. Our psychiatric instructor is one of them. I needed help, and I went looking for it. Hi, Betty.
Well, hi, Dio.
Boy, did you send me a prize package in that little student, and have I ever got a problem. Can I sit on your couch and tell you about it?
Sure, sit down. Have a chair.
I realized the kind of leadership I had provided the staff. We had missed the boat with this patient for 4 months. One of the difficulties on a busy ward is that no one takes time to study a nursing problem systematically. We're all too busy with tasks to stop and look at what's happening. But we've got to stop, and it should be worth the effort. What we can learn from studying Mrs. Reynolds' care is bound to affect the nursing care of all other patients on the ward. First, I had to get the staff to see Mrs. Reynolds as a human being. Expressing my feelings about her allowed them to get their own feelings out into the open where we could look at them together. What else? Come on, I feel the same way.
Oh, she's always calling us honey and dearie, and boy, that just gripes me.
Well, I don't mind that, but she's always talking about us behind our backs.
That isn't all she does. She reports us.
So does her husband. He watches everything we do.
Okay, let's stop. Isn't it strange that not one of us has said a single good word about her? Okay, what do we mean when we say it takes so much time?
Before you even do anything, she has 10,000 complaints.
I'll bet it takes an hour and a half to feed her.
What do you mean it takes an hour and a half to feed her? Do you time it?
What would happen if we kept track of everything we did for this patient for a few days?
That's a darn good idea. Let's write down everything we do for her, including her requests and demands.
Maybe then we'll get more help.
I wasn't worried that the staff felt that this was a chance to prove something to me. I was sure the study would mean much more to all of us.
Now, you just take your time, Mrs. Reynolds. Don't hurry at all. Just take lots of time.
Just rub my legs, dearie.
Why, sure, Mrs. Reynolds, and anything else you want, just ask for it.
You just let us know when you want us to section you again, Mrs. Reynolds.
You must not be very busy today, I guess.
Never too busy to make you comfortable, Mrs. Reynolds.
Here's that nice cold water you wanted, Mrs. Reynolds. Now, if you need anything else, you be sure and let me know.
Thank you. What are you writing on that piece of paper, dearie? Why are people being so nice to me?
Wait till the supervisor sees this.
7 hours and 42 minutes a day of tender, loving care.
Let's do this up real pretty.
Care which for 4 months had been anything but tender and loving for any of us. But without really realizing it, all the staff was beginning to be interested creatively for the first time in the care of this patient.
The prize package.
I guess this should make her sit up and take notice.
She thought she had me right where she wanted me, but her interest had been caught along with all the others.
Thicker than my life history. You're real sweet.
Okay, now what have you got for the totals for this? At the next meeting, I made sure that everyone had copies of all the data, and we summarized it together. And once we had the facts before us, they seemed to ask their own questions.
Why does she have to ask for more coffee? Why don't we just order it?
Why 19 requests for a drink? The doctor has ordered that she get 2,000 cc's a day.
Well, look at your sheets. When did she ask for all these drinks?
Well, she almost consistently asks when you come into the room or when you're leaving.
I kind of think maybe she wants to be sure you'll come to her, and then she doesn't want you to leave.
Maybe she's afraid to be alone. She wants to be suctioned then.
Does she need it this often?
No, we'd traumatize her trachea if we did it that often.
Well, what do all these requests mean?
Stephanie says she thinks Mrs. Reynolds is afraid of choking to death.
Well, what can we do about all this?
We can check her trach, listen to her chest whenever we see her, and tell her when it's clear.
Maybe she wouldn't be so afraid if we told her when we were coming back.
All right, let's try a few of these things before the next meeting and see if they really work.
We're going to check your trach and listen to your chest to make sure you're breathing all right. Your trach is clear. You seem to be breathing fine. Your chest sounds clear. How about a drink of water? I'll be back in 15 minutes. Now you try and get some rest. Say, this is really working. She hasn't been incontinent for 3 days. You remember we thought it was her illness that made her wet the bed? You remember how worried she got about suctioning? She doesn't ask for it half as much now.
How are you, Mrs. Reynolds?
Oh, I'm a lot better, nurse. But you know, she says she'll be back in 15 minutes. And lying here alone, 15 minutes sometimes seems like 15 hours.
I'll be back in 1 minute. See if you can time that.
When the head nurse began to take an interest in the plan, I knew we had passed over a major hurdle and that things would now go well with this patient and with the staff caring for her.
Now you'll see what they mean.
How does this sound to you?
We now began to develop a 24-hour plan of care and to involve Mrs. Reynolds in it. She made decisions about her diet. We scheduled care around her favorite TV programs. Then we involved him.
That wasn't so bad, was it?
Not at all. I think I can handle that all right.
And if you get into any trouble, just get one of us. We'll be glad to help you.
Thank you.
He was with her most of the day. He would have to suction her when she went home, and he wanted to help. And so he entered the partnership that now involved all of us.
How's that?
That's good. It's always better when you feed me.
Oh, now you're trying to soft soap me, girl.
The sun began to shine in this ward, and Mrs. Reynolds improved markedly. They began to look forward to her going home. The staff now looked on them as friends and began to gain the satisfactions they had never before received from caring for this patient. And at our meetings, we discovered that staff time now spent in Mrs. Reynolds' care had dropped from 7 hours and 42 minutes a day to 1 hour and 50 minutes.
You're doing very well, but it must be difficult to talk and to eat.
I don't mind though as long as John can feed me.
Don't cry. What's the matter?
No plan is without its problems and reversals. There came a time when Mrs. Reynolds reverted completely to her old, unhappy, demanding, incontinent state.
Has she told you anything as to why she's unhappy? Do you hurt? Oh, maybe you could fix her pillow and rub her neck or something.
No one could learn from her what had gone wrong. We felt that in some way we couldn't understand. We'd failed her again. The staff had to be helped to understand that there were reasons for Mrs. Reynolds' setback. Okay, let's go back and see when her care started to change. What happened?
Well, I don't know if this is important, but you know Mrs. Jones, who was a roommate for such a long time, when she was discharged.
And the day she left, remember? We put that poor old lady in Mrs. Jones' bed, and she died.
And Mrs. Reynolds coughed out her trach tube, and that new intern had trouble getting it back in.
I guess she was just afraid of dying again.
When we understood, we could help her once again. And once again, all was well with the Reynolds.
How nice.
I thought you'd like some of these flowers.
Oh, thank you, Mr. Reynolds. They're beautiful.
For Christmas number 4. Number 2.
Oh. John, they're lovely. Why don't you put one in your buttonhole?
Hello there. How are you folks today?
Because of what we had learned about Mrs. Reynolds' care, we began to deal more effectively with the nursing care of other patients on the ward.
For the day.
Hi, Mrs. Reynolds. How are you doing today?
Oh, wonderful.
Good.
Everything's better.
Mrs. Reynolds was certainly happier, but the doctors were becoming very concerned over her increased respiratory involvement. And so the days passed. It is 8 months since the Reynolds came down the hall to our ward. 8 months that has taught us all a great deal that we will never forget about nursing and what it means.
He's got it into the stretch, the windup, and that pitch is in there. He's out. The game is over.
Mrs. Reynolds?
Thank you.
I wonder who will come next.